Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Tonsillectomy surgery. Everything you need to know. Tonsillectomy is a surgery to remove the tonsils, lymphatic organs in the throat that protect your body from infection. Healthcare providers may consider removing the tonsils in the following circumstances: /r/n/r/n. Your adenoids sit behind the nose in the throat. Like tonsils, they are part of the lymphatic and immune systems. In some cases, most often in children, a tonsillectomy and adenoidectomy, surgical removal of the adenoids, are performed simultaneously. This surgery is dubbed a T&A/R/N/R/N. This article explains when doctors advise tonsillectomy and what to expect from the procedure and recovery. /R/N/R/N. A tonsillectomy is performed under general anesthesia, which means you will be asleep during the procedure. The surgeon removes the tonsils through an open mouth, so there is minimal cutting and no scarring. /R/N/R/N. There are two types of tonsillectomies, /R/N/R/N. A tonsillectomy is usually a scheduled surgery and is rarely performed on an emergency basis. Most tonsillectomies are outpatient procedures in a hospital. However, in some cases, you may need to stay overnight. /R/N/R/N. The tonsils are glands on both sides of the back of the throat that help protect against infections. /R/N/R/N. Your healthcare provider may suggest a tonsillectomy for one of the following reasons. /R/N/R/N. The American Academy of Otolaryngology Head and Neck Surgery strongly recommends watchful waiting for recurrent throat infections before having a tonsillectomy. /R/N/R/N. Call your healthcare provider if you or your child has had a sore throat for more than 2 days, pain when swallowing, or feels very sick or weak. Also, call 911 if you have trouble breathing, start drooling, or have significant difficulty swallowing. /R/N/R/N. Both adults and children have tonsillectomies. But children younger than 2 years old may have a higher risk of respiratory complications with this surgery. To assess the risks, your child's doctor may order testing before surgery, such as polysomnography, sleep study. /R/N/R/N. Since bleeding is a potential complication of this surgery, patients with certain risk factors may require an additional evaluation before the surgery. Risk factors that may need extra caution include /R/N/R/N. In addition, atypical uvulas, such as a bifid uvula, a uvula that is split in two, or double uvula, require special consideration. The uvula is the flesh that hangs down in the back of the throat. /R/N/R/N. Children under 2, people with bleeding disorders, those with a history of anesthesia complications, and those with atypical uvulas may be at increased risk for tonsillectomy complications. /R/N/R/N. Complications of tonsillectomy are rare, but when they occur, they can include /R/N/R/N. Removing the tonsils doesn't affect your body's overall ability to fight infections because your immune system can do that in other ways. Still, infection post-surgery can occur. /R/N/R/N. In addition, general surgical risks include /R/N/R/N. Most people tolerate tonsillectomy well. However, as with any surgery, there are some risks, including bleeding, dehydration, prolonged pain, and infection. In addition, some people experience complications associated with anesthesia. /R/N/R/N. Before a tonsillectomy, your surgeon may recommend a physical exam and blood tests, including complete blood count, electrolytes, and clotting factors, to ensure that you will tolerate surgery. /R/N/R/N. Both kids and adults may feel anxious about this surgery. Your surgeon can help answer any questions you or your child may have. Often, talking with your doctor can ease your concerns. /R/N/R/N. If your child is having a tonsillectomy, talk to them about any worries. Reassure them that the procedure will make them better and that they won't look any different afterward. You might tell them that their throat will be sore for a little while post-surgery, but they will be able to take medicine later to help it feel better. /r/n/r/n A tonsillectomy usually occurs in an operating room at a hospital or a surgical center. In either case, you'll likely go home the same day. /r/n/r/n Comfortable, loose-fitting clothes that are easy to change are ideal since you'll need to wear a hospital gown for the procedure. Leave any jewelry at home so you don't worry about losing it at the hospital or surgical center. /r/n/r/n Surgeons usually instruct people to refrain from eating or drinking anything after midnight the night before the surgery. Follow your healthcare provider's instructions to make sure your stomach is empty. /r/n/r/n For children, you might try giving them their favorite foods the night before so they fill up and aren't as hungry in the morning. In addition, you can ask for an early morning surgery to reduce the amount of time they have to go without food. /r/n/r/n Your healthcare provider may recommend that you stop taking certain medicines a week or two before surgery. These medications may include /r/n/r/n Ask your healthcare provider if there are any drugs you or your child should keep taking before and on the day of the surgery. /r/n/r/n To avoid complications, be sure your surgeon is aware of any medications or supplements you or your child uses before the procedure. Inform your doctor of any over-the-counter, OTC, products, prescriptions, vitamins, and herbs. /r/n/r/n Be sure to bring your health insurance card and any paperwork you've filled out. /r/n/r/n If you know that you'll be spending the night, bring a small suitcase for you or your child with a change of clothes and comfort items. For example, your child might like to bring a blanket, toy, or stuffed animal. /r/n/r/n If you're the one having the tonsillectomy, remember to make arrangements for someone to take you back home. /r/n/r/n When you arrive, you will change into a gown, and the anesthesiologist and nursing staff will meet with you to go over important medical history and take your vitals. Then the anesthesiologist will administer general anesthesia. Parents can usually stay with their child until the child receives anesthesia, at which time they will go to the waiting room until the surgery is over. /r/n/r/n You will receive intravenous, fluids during and after the surgery. The anesthesiologist will keep you or your child safely asleep while undergoing the procedure. /r/n/r/n The surgeon will place a small tool in the mouth to hold it open. Then, they will remove the tonsils by cutting, burning, or shaving them away. These wounds heal naturally and don't require stitches. /r/n/r/n The tonsillectomy procedure will usually take about 20 to 30 minutes. /r/n/r/n You or your child will wake up in the recovery area. The staff will provide close observation for several hours. Easy breathing, coughing, and swallowing are all milestones you'll need to meet before discharge. /r/n/r/n If your child has complications, like bleeding or slow recovery, they may need to spend the night. /r/n/r/n On the day of the surgery, a nurse and an anesthesiologist will prep you for surgery by taking your vitals and administering anesthesia. The procedure typically takes only 20 to 30 minutes. During the process, the surgeon will remove your tonsils by cutting, burning, or shaving them. You usually go home within a few hours, but you might need to stay overnight if you have complications. /r/n/r/n Adults usually recover more slowly from tonsillectomies than kids. Children tend to recover in about a week after surgery, while adults need 10 to 14 days. /r/n/r/n Though pain and discomfort can make it hard to eat and drink, especially for kids, it's essential to avoid dehydration. Be sure to take in lots of fluids or offer your child a drink often. Good fluid choices after a tonsillectomy include /r/n/r/n Until your pain subsides, your healthcare provider will likely suggest sticking to soft foods, such as /r/n/r/n. Some kids find the sweet, soft treats a silver lining, so you might mention it even before surgery. /r/n/r/n allow for up to a week of rest after tonsillectomy. In addition, you or your child should avoid blowing your nose forcefully for 2 weeks after surgery. /r/n/r/n also, avoid any strenuous activities or sports for 2 weeks. The healthcare provider will let you know when light activities are okay. /r/n/r/n immediately let your healthcare provider know if there is any bleeding from the mouth or nose. Also, let them know if your child won't drink any fluids after the surgery. /r/n/r/n pain in the throat will probably last for several to 10 days. Your healthcare provider may suggest taking Tylenol, acetaminophen, or will give a prescription for Tylenol with codeine at the time of surgery. However, children younger than 12 years should not be given codeine after tonsillectomy. /r/n/r/n It can take up to 2 weeks to recover from a tonsillectomy. Children tend to bounce back more quickly, while adults may experience pain longer. Eating soft foods and avoiding things like blowing your nose forcefully and avoiding strenuous activity for the first 2 weeks can help you heal faster. In addition, taking pain medications as advised by your doctor can help manage your pain. /r/n/r/n You may need a tonsillectomy if you have recurrent infections or difficulty breathing while you sleep. Most people tolerate the procedure well. However, as with any surgical procedure, there are some risks, including bleeding, pain, infection, and complications with anesthesia. You will be asleep during the 20 to 30-minute procedure, and most people go home the same day. Recovery generally takes 1 to 2 weeks. /r/n/r/n After a tonsillectomy, you'll likely deal with short-term throat pain, but it should lead to fewer sore throats and better breathing at night in the long term. Ask your healthcare provider if you have any questions about expectations before and after the tonsillectomy. They'll discuss the risks and benefits and help you determine whether a tonsillectomy is the best treatment for you. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.